Hey, what's up, everyone? This is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating the 2022 Headmaster Testable Skill Perineal Care on a male resident with brief change with hand hygiene. Okay, so in this skill, you'll be performing 3 different nursing tasks, okay? I've already have my supplies set up. I just want to uh, tell you that at your Headmaster testing site, your supplies will not be stored at the bedside. You will not have any supplies stored inside of the bedside stand. Your supplies will be located on a centralized table that is in the testing room, okay? Now, for your linens, such as your bed sheets, your bath sheets, your washcloths, towels, waterproof pads, maybe even your Chucks pads, if they are not on that centralized table, they will be in a file cabinet somewhere in that testing room. Again, easily accessible to you, okay? So I already have my supplies gathered. I have them organized on my table, and I wanted to do this like this for this video because it's kind of sort of a lot of supplies that you'll have to collect, okay? What I've done is I've organized my supplies in the exact order in which I will have to use them. If you're able to do this, that will be awesome, okay? Because it will help you to remember what step comes next, okay? So let's go ahead and get started. Hi, good morning, Mr. Smith. How are you? Awesome. My name is Julie. I'm your CNA, and today I'm going to be changing your brief and giving you or providing you with peri-care, okay? All right, Mr. Jones, before I get started, I'm just going to sanitize my hands. You will have to use actual hand sanitizer to sanitize your hands, and make sure to rub your hands until they are completely dry. All right, Mr. Smith, I just want to make sure your bed is in a low safe position, and it is. Your bed walls are locked. I'm going to give you your call light in your hand. Just press this button if you need me for anything, okay? I'm going to provide you with privacy by closing your privacy screen. Mr. Jones, before I go gather my supplies, is there anything I can do for you? All right, Mr. Jones, I'll be right back with my supplies. All right, so as I stated at the beginning of this video, I already have my supplies set up. All right, Mr. Jones, I have all of my supplies. I'm going to go fill the basin with some water, okay? And I'll be right back. Now, this step specifically states warm water, so if at the testing site the sink has one handle, you'll want to turn that one handle to the center setting. If it has 2 handles, then you'll want to turn on both handles. Now, when testing the water, you can test it while you're filling the basin at the sink, but just make sure you verbalize loud and clear and you actually do it so the nurse aide evaluator can hear. Or you can wait till you get back to the bedside to test the water, okay? You can test with the finger, with your wrist, with your elbow. You can even test with a gloved hand. I'm turning on both taps. I'm testing the water. Okay, Mr. Jones, I have filled the basin with water. I've tested it. It feels good to me. Now, I would like for you to test it to make sure it's a comfortable temperature for you. Awesome. Now, there will be some NAEs that will speak for the resident and then some that won't, okay? But you have to make sure that you perform this step, okay? After you test the water, then you will want the resident to test the water also, okay? Mr. Jones, I'm just going to raise your side rail because I'll have to be turning you, okay? Now, you can either raise the resident's side rail, or you can ask the NAE to come stand on the side that you're going to be turning the person. Now, the NAE is not going to move unless you ask them to. In this demonstration video, I will be raising the side rail. Okay, I got your side rail all raised. All right, Mr. Smith, I'm just going to raise the level of your bed to a comfortable working height for myself, okay? As with Parametric, Headmaster also emphasizes the employment of body mechanics. So if you need to raise the level of the bed to a comfortable working height for yourself, please do so. Okay, I think that is good. All right, Mr. Jones, the first thing that I'm going to do is just lower your sheets, okay, just down to your knees. And then I'm going to raise your gown to hip level. To ensure that you do not overexpose the person, you do not want to raise the gown higher than hip level, and you do not want to lower the person's sheet lower than knee level. Now, the supply that I have next are my gloves, and you're going to need 4 pairs of gloves for this skill. So I'm going to put on my gloves. The next supply item I have is a chucks pad. I'm going to use this chucks pad as a linen protector. If the testing site does not have chucks, you can always use a towel or a waterproof pad. I'm just prepping my chucks, rolling it towards me, and then I'm going to line it up, making sure that I have it completely underneath the person's buttocks and peri area. And then I'm going to push it up underneath the person as much as possible. At this time, you can turn the resident onto his side, or you can raise the resident's hips. In this demonstration video, I'm going to raise the resident's hips. Mr. Jones, on the count of 3, I'm going to raise your hips to pull the linen protector through, okay? I'm just placing my arm underneath your thighs, and then on the count of 3, I'll lift and pull the linen protector through. 1, 2, 3, lift. Good job, you're doing awesome. Okay. All right, I'm just making sure that it's completely underneath your buttocks, and it is. I'm going to go ahead and readjust your gown and your sheets, making sure you do not remain overexposed. The next thing that you'll want to do is to remove the soiled brief. Mr. Jones, I'm just going to remove your brief. Okay, and then on the count of 3, I'm going to raise your hips again to completely remove the brief, okay? Just placing my arms underneath your hips. On the count of 3, I'll raise your hips. 1, 2, 3. So I've raised the hips and I'm rolling the brief away from me. Just readjusting your sheets. And then I'm going to immediately dispose of the brief into the waste bin. At this time, I'm going to remove my gloves without contaminating myself. Dispose of them, and then sanitize my hands with actual hand sanitizer. Okay, my hands are completely dry. Now I will put on my second pair of gloves. Mr. Smith, I'm just putting on my some clean gloves. There we go. Okay. Now the first washcloth, I'm going to wet it, squeeze it out, apply soap, then I'm going to rub it together to ensure I get soap over all areas of the washcloth. I'm going to fold it back into fours. And then I'm going to grasp the penis and I'm going to start cleaning the tip of the penis in a circular motion from the urethra out. So I'm just going to place the washcloth on the penis and just in a circular motion clean it, okay? Then I'm going to flip the washcloth over or turn it over to expose a clean area of the washcloth. And now I'm going to clean down the shaft. And then on the other side, clean down the shaft away from the urethra. I'm going to place this washcloth on my basin. I'm going to take my second washcloth, wet it. I'm not putting soap on it because I'm going to use the second washcloth to rinse the penis. So in the same fashion that I wash the penis, I'm going to rinse it. So I'm grasping the penis, cleaning the tip of the penis in a circular motion, okay? Then I'm turning the washcloth over to a clean area. I'm cleaning the shaft of the penis. There we go, okay? Then I'm gonna place this washcloth over the basin. My third washcloth, I'm going to wet it, squeeze out all the water, open it up, apply soap, rub the washcloth together so I can make sure I get soap on all areas of the washcloth, fold it back into fours, and now I'm going to clean the scrotal sac. I'm going to hold the penis. I'm going to, in a circular motion, starting at the top of the scrotal sac, and just clean in a circular motion. I'm going to hang this washcloth on the side of the basin. I'm going to take my second washcloth, wet it, squeeze it out. I'm not putting soap on it. In the same manner that I washed the scrotal sac, I'm going to now rinse it in a circular motion. Now I'm going to hang this washcloth on the side of the basin. Now the next item that I have is a towel. So this is letting me know that I need to dry the areas that I just washed and rinse. And I'm going to do this by patting dry the area. Okay. The dirty side of the towel I'm going to place on the table. Okay, so the top side I know is clean. At this time, I will remove my gloves without contaminating myself, immediately dispose of them, and then sanitize my hands with actual hand sanitizer. Again, rubbing my hands until they are completely dry. Now I'm going to place my third pair of gloves. Mr. Jones, I'm just putting on a clean pair of gloves. Once I get my gloves on, I'm going to turn you on your side, okay? Okay, Mr. Jones, if you could, I'm going to move you closer towards me on the count of 3, okay? 1, 2, 3. Awesome job. Now I'm going to turn you on your side, okay? If you're able to hold on to the side rail, you can, okay? If you could, go ahead and bend your knee for me, and then I'll give yourself a hug. There we go. And then on the count of 3, I'm going to turn you. 1, 2, 3. Awesome. You doing okay? Awesome. Just going to recover you because I don't want you being overexposed. Okay. Now I'm going to clean the buttocks and anal area. So I'm going to take my 5th washcloth, wet it, squeeze it out, apply soap, rub the washcloth together to get soap on all areas of the washcloth. Then I'm going to fold it in 4s. I'm going to have it to where I have the 4 open leaves on top, okay? And I'm going to tuck it in so there will be no parts of the washcloth hanging. I'm going to clean the buttocks and anal area, working from the scrotum up towards the back, okay? So we're going to go from the scrotum up to clean the anus, flip the washcloth over, clean one butt cheek, flip over, clean the second butt cheek or the opposite butt cheek, and then the last leaf, I'm going to work from the scrotum all the way up to clean the anal area. I'm going to hang this washcloth on the side of the basin. My 6th washcloth, I'm going to wet it. I'm not going to put soap on it. I'm squeezing it out. Again, I'm going to keep it in 4s with the open leaves on top. And in the same manner that I washed the buttocks and anal area, I am going to rinse the buttocks and anal area. So working from the scrotum up to clean or rinse the anus, then rinsing one butt cheek, flipping over to a new leaf to rinse the opposite butt cheek, flipping over to this last clean leaf, working from the scrotum up to clean the anal area. Then I'm going to hang this washcloth on the side of the basin. Now remember, my clean side of the towel is facing up, so now I'm going to pat dry from the scrotal sac upwards. Okay, so I'm drying from front to back. Okay. At this time, I'm going to remove my gloves, immediately dispose of them, sanitize my hands with actual hand sanitizer, and again, I have to stress that you have to rub your hands together until your hands are completely dry. Okay, they are dry. Now I'm going to put on my 4th pair of gloves. Mr. Jones, I'm just putting on my gloves and then I'm going to place the clean brief on you, okay? All right, so now I have the brief. I'm going to open it up. Make sure that the tape is towards the headboard. Okay, so the tape on the brief needs to be on top. I'm just going to place it underneath the person as much as possible. Then I'm just going to bring it around, okay, like so, because I need to make sure that it's an even amount of the brief on both sides, okay? And I'm going to put the middle of the brief in between the patient's legs, all right? Now what I'm going to do, since I have the resident exposed and turn on their side, I'm going to go ahead and roll the linen protector away from me, and I'm also going to push that up underneath the person as much as possible. That will make it easier for me to remove the tucks, okay? All right, Mr. Smith, on the count of 3, I'm going to go ahead and turn you back over on your back, okay? 1, 2, 3. Awesome job. You doing okay? Awesome. Okay, I'm just going to roll this chucks up. There we go. Just making sure I have an even amount of the brief on both sides, and I do. I'm going to go ahead and secure your brief, Mr. Smith. There we go. We'll get this other side secured. Okay. Now I'm just going to pull down your gown. I'm going to remove and dispose of the linen protector. I'm going to get you covered back up. You have your call light here. Okay, and I'm just going to move you to the middle of the bed. There we go. All right, you doing okay? Awesome. All right, so at this time, I'm going to lower the bed back down to a low safe position. Mr. Smith, I'm just lowering your bed down to a low safe position. There we go. Your bed wheels are still locked. I'm going to lower your side rail because you do not have doctor's orders for these side rails. I only raised them while I was providing you care. Okay? You still have your call light in your hand. Privacy is still maintained. Mr. Smith, before I go dispose of my supplies, is there anything else I can do for you? All right, Mr. Smith. Okay, so now I'm going to dispose of my soiled linen, carrying it at arm's length into the soiled linen hamper. I'm going to empty, rinse, and dry the basin in the sink. And rinsing. Now I'm drying the basin. I'm going to throw away this paper towel. Just going to place the soap back into the basin, and wherever your storage area is at the Headmaster test site, that's where you will restore these reusable supply items. Now I'm going to remove my clean barrier and dispose of it into the waste bin. Again, if you used a towel or a towel for the clean barrier or linen protector, or if you used a waterproof pad for the linen protector, make sure you dispose of it appropriately into the soiled linen hamper. At this time, I'm going to remove my gloves. Immediately dispose of them. Sanitize my hands with hand sanitizer. Rubbing my hands until they're completely dry. Okay. Now I'm just going to replace the equipment. Make sure Mr. Smith is in a comfortable position. Again, his bed is still in the low safe position, bed bolts are locked, he still has his call light. Mr. Smith, would you like for me to keep your privacy screen closed, or would you like for me to open it? Okay, I'll open it up for you so you can see. Mr. Smith, is there anything else I can do for you before I leave? All right, Mr. Smith, well, you have a good day, okay? All right, at this time, you will go to the sink and you will perform hand hygiene. So I'm just gonna turn this trash can over, get my camera so you can see the hand hygiene skill. So if your sink at the testing site has one handle, you'll want to turn that one handle to the center setting. If it has two handles, you'll want to turn on both handles. My sink has two handles, so I'm going to turn on both handles. Now, if you're wearing any type of wrist, hand, or finger jewelry, you'll need to remove it before you perform hand hygiene with actual running water and soap. So I'm turning on both handles. I'm wetting my wrist, hands, and fingers, gently clapping my hands together to remove any excess water. I'm getting a lot of soap. And now I will start lathering my hands for at least 20 seconds, maintaining my hands below the level of my elbows with fingertips down, okay? Using the storm count will help you to meet that at least 20 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. You want to make sure that you lather both wrists. Intertwine your fingers to clean in between your fingers like I'm doing. And also clean your thumbs. 21 1,000, 22 1,000, 23 1,000, 24 1,000, 25 1,000. Now you'll clean underneath your nails by rubbing your nails against the opposite palm. And don't forget your thumbnail. Now you can rinse and make sure you remove all soap from your lower arm, wrist, and hands, maintaining your hands below the level of your elbows with fingertips down, making sure you do not touch the insides of the sink. If you accidentally touch the insides of the sink, you'll need to stop, look at the nurse aide evaluator, and let him or her know that you accidentally touched the insides of the sink, and ask them whether they would like for you to restart the hand hygiene skill. Now what I'm doing is just twisting my wrist, making sure I keep my hands below the level of my elbows with fingertips down. Just checking to make sure I have removed all soap. Okay, now I'm going to gently clap my hands together to remove any excess water. I'm going to get some paper towels and begin drying my hands by drying each individual finger on each hand first. Now I can dry the remaining areas of my lower arms, wrists, hands, and fingers. Dispose of that paper towel. Get another paper towel to dry my hands until they are completely dry. Dispose of it. Get another clean, dry paper towel to turn off the taps. All right, guys. At this time, you will tell the NAE skill complete. It's very important that you notify the nurse aide evaluator that you will have completed a task or a skill. Okay? At this time, the NAE will have you go into the relaxation room while he or she and the contracted acting resident set up the room for your next skill. Okay, so you stating skill complete lets the NAE know that you have completed that skill and you're ready to move on to the next. Okay, I hope you all enjoyed this video. I hope it was useful.